Chapter 6, the human body. All right. You must understand the basic structure and functions of the human body. We can't do emergency medical responder unless we know where the body parts are. We need to understand the underlying conditions, what the symptoms are that the patient is talking about. We need to be adequate information upon examination of the patient. That is why we continuously redo our surveys the whole time so we can accurately understand what's going on. We need to be able to communicate our exact findings to others and provide them appropriate medical treatment in a timeliest manner. All right, let's start off with topographic anatomy. Very simple. Topographical man, the patient lying on his back, facing up, hands facing out, thumbs pointing out to the side. Okay. When we look at the middle of the body, we see that they have an imaginary midline. Anything towards the midline is medial. Anything away from the midline is lateral to the patient's outside of the body. Always remember that the patient's left is your right. It's a mirror image. So the patient, that we never give our directional terms, we always use the patient's body for directional terms. So it's either midline or lateral. If it's towards the head, it would be superior. If it's towards the feet, it's called inferior. When we talk about the extremities, we talk about distal circulation, the distance away, the furthest point away from the attachment to the trunk. Okay. Proximal, always the closest point of attachment of an extremity to the trunk. When we talk about the front and the back of the patient, we talk about the anterior and the posterior. Posterior being the back, anterior being the front of the patient. Okay. As I said, we did all this already. We talk about if he has a fractured rib, which would be towards the edge of the body, towards the outside, it would be lateral, third left lateral rib fracture. Okay. When we talk about circulation, after we apply dressings, bandages, and splints, we talk about distal circulation or distant circulation. Okay. We always press the fingernail bed for 5 seconds, hold it for 5, and then release. It must go from white to pink in exactly 2 seconds, no longer. All right. When we look at the different parts of the body as well, we look at the different systems of the body. Okay, each system of the body is designed to do a specific function. However, most of the systems of the body come together to remove waste products. So the respiratory system is a structure that involves breathing. So it would be your lungs, your diaphragms, and the nerves that control these diaphragms and things like that. They bring oxygen into the body and removes waste products. Most people, unless you have COPD or something like that, have a carbonic drive. We breathe to get rid of carbon dioxide. Okay, less so to get oxygen. When we look at the respiratory system, there's an upper airway and a lower airway. The upper airway is always the nose, the mouth, the throat, trachea, okay, pharynx, oropharynx, nasopharynx, okay, the back of the mouth there. When we talk about the upper airway infections, we always talk about smaller infections, laryngitis, pharyngitis, things like that. When we look at lower respiratory tract infections, we look at things like pneumonia, asthma, bronchitis, things like that, the more serious type of things. There we go. Yes, nose, nasopharynx, mouth, oropharynx, throat, larynx being the voice pipe, trachea being the windpipe, and passage to the lungs, the bronchies. There's the picture again. Yes. Epiglottis is the little flap membrane that covers the throat and prevents water and food stuffs and things like that entering the lungs. Or when we breathe in, the diaphragm is contracted, pulls down, air rushes into the pleural into the lungs, because there's a negative air pressure in the lungs, so it's moving from outside to inside. Okay, when we exhale after a rest period, there's always a rest period, then the diaphragm relaxes again, forces the air up and out of the lungs. Things that we need to do to have the air, we need to talk, we need to cough. We can't do those without any air in our lungs. Okay, the circulatory system. Now, this basically includes the heart and the blood vessels, the vascular system. All right, the heart pushes the blood out. Blood contains certain particles that is vital for our survival, vital for carrying oxygen around the body, and the veins bring it back to the heart again. Obviously, the lungs get air, and the air moves into the blood. Let's have a closer look at it. Blood picks up oxygen in the lungs. The hemoglobin in the blood attracts the oxygen. The heart pumps it to the rest of the body. Okay, the blood flows into the heart on the right-hand side and leaves the body on the left. Cells absorb the oxygen and nutrients from the blood and release waste products. There's the waste products being taken out again. Blood carries the new waste products and the things back to the lungs and kidneys. Kidneys filter the blood, keep it clean. The lungs expel carbon dioxide and enable the reabsorption of oxygen. Okay, this takes place in the alveoli and between the little small blood vessels in the lungs. The heart consists of 4 chambers. 2 on the top are called atrium or atria. Atria is just another word for an entrance or hallway. Okay, each lower chamber is called ventricles. These are the chambers that pump the blood forward in the body. Right ventricle is used to pump the blood through to the lungs. Left ventricle is used to pump the blood through to the rest of the body. One-way valves stop and check the heart, the blood from flowing backwards in the heart. And it always works with an electrical impulse. Like any good pump, we need a good flow of electricity for these things. We look at the picture of the heart here, we can see the blue of veins on the right-hand side receiving blood from the body. The red, bright red, are arteries where blood is pumped out of the body, the heart into the body under pressure. Where the arteries cross over a bone, we will have a pulse. Okay, these are the places in the arteries where we can check for the strongest pulse of the body. Carotid arteries, always important to remember where these are and the names of them. The neck, just underneath the jawline, the angle of the jaw, 2 fingers down, you'll find a carotid artery or carotid pulse. Femoral artery or femoral pulse will be found midline in the top of the thigh between the inside of the leg and the outside of the hip. Radial pulse or wrist will be found on the radial bone as you run your finger down from the thumb towards the radius, the wrist part of the bone, slightly down, and you will find your artery there, or you'll find your pulse in that point over there. Some of the other ones you might find them, brachial pulse between, if you look on the picture over here, I will show you, kind of like inside of the elbow between the bicep and the tricep. You'll find a pulse point there. This is the only place you'll find a pulse point on an infant. Okay, we always use it as a reference guide for pulse on infants. All right, blood. The capillaries are obviously the smallest blood vessels in the body. Veins are thin-walled vessels that carry blood back to the heart. Now, in the veins, there's always one-way valves to stop the blood flowing backwards. Okay, sometimes they don't work so well, and we end up with varicose veins. Okay, blood consists of plasma. The volume of blood, the fluid of the blood, is plasma. Okay, then we have red blood cells with hemoglobin. Hemoglobin attracts the oxygen, and white blood cells, which are your fighters, the people, the soldiers that are going to protect you from the viruses, bacteria, infections, things like that. Platelets or thrombocytes are involved with the clotting of blood. Sometimes you have malformed platelets or things like that, and you end up with a disease like hemophilia, or you have a blood clotting disease. All right, the skeleton, the skeletal structure consists of bones. Bones are hard, bones protect the body. There's three major, maybe four things. Let's look at the three that are here. Support the body. Obviously, it provides a framework. Okay, for the attachment of muscles, it has joints that supply and aid in movement. Okay, it protects the vital organs. Rib cages are protecting the ribs in the lungs and the arteries, the major arteries in the heart. Not only that, they also manufacture red blood cells. They also carry bone marrow, which is vital for the development of white blood cells. Okay, and fat as well. Bones, the large bones, the femur, and things like that have fat inside. That's part of that bone marrow, which is part of the development of cells that are identical to our own body. They're individual, they're unique. If the person has something like leukemia and they can find a donor, then they would give a bone marrow transplant. Okay, there's the bones, 206 bones in the body. Yes, everybody's got the same bones. Some might have an extra coccyx or something like that bone, but 99.9% of the time it's 206 bodies, unless they're missing a limb or something like that. All right, different areas of the bones. The skull consists of two bones. Obviously the head, the skull itself, and the lower jaw, the mandible. Okay, with a baby, bones aren't fused in the skull, but they protect the brain. That's why head injuries are so much more worse in babies than they are in adults. Adults have hard bone to protect them. The jawbone is the only movable part of the bone of the skull that completes the structure, so that you can chew. The spine consists of 33 vertebrae. Okay, each vertebra has points of attachment for muscles, tendons. Between each vertebra, there's discs and there's ligaments that surround the spinal cord or spinal column, keeping it in shape, intact, and things like that. Now, let's be sure that we know that these vertebrae are exceptionally important. Okay, they not only provide a protective barrier for the spinal cord, which the nervous system runs through. Okay, they also allow for movement, articulation, things like that. The discs between the vertebrae act as shock absorbers. Okay, and ligaments and tendons and things like that supply structure to these bones as well. If we look at the spinal cord passes through the central hole of each vertebra. The spine has 5 sections: thoracic spine, C1 to C7, lumbar spine, L1 to L12. Each rib is attached to a thoracic spine. Lumbar spine, L1 to L5, the lower back. Okay, sacrum is a fused part. It sits in the pelvic area. It's S1 and S5, S1 to S5. The coccyx is the tailbone. Also has nerves running through it and spinal cord, and that is coccyx 1 to 4. Right there, they are in order. You can see them: 1 to 7, 1 to 12, 1 to 5, 1 to 5, and 4. Now, there's a pair of nerves that run out each side of the spinal column. Okay, because we have 2 sides to our body, left side and the right side, so there must be 2 sets of nerves for each side. Okay, shoulder girdles in the back. The shoulders supports the arms, consists of 3 bones. The collarbone or clavicle, you'll feel just to the left and right of the jugular notch, where the shoulder blade, the collarbones come together by the center of the throat. The shoulder blade or the scapula, okay, allows for muscles to be attached and controlled and keep the shape of the arm, things like that. Okay, the upper bone, which is the humerus. Nothing funny if you hit your elbow though. Okay, on the humerus we have a bicep and tricep, and the upper extremity consists of the 3 major bones: upper arm, humerus, and in the lower arm, forearm, it's the radius and ulnar. The wrist is carpals, hands, metacarpals, fingers, phalanges. Okay, there we go, exactly what I told you now. Rib cage, there are 12 ribs, 12 sets of ribs, protecting the heart, lungs, liver to a certain degree, and the spleen, which lies behind the stomach, underneath between the ribs and the stomach. There we go, the skeletal system, the rib cage. You'll see there's 12 ribs. You might only count 11 in front, but there is a one at the back that's hanging around by the kidneys. The xiphoid process is the bottom of the sternum. Okay, it's very loose and quite easily be broken, so beware. When we're doing CPR, we always finish for the center of the chest. Okay, the pelvis. The pelvis is a large bowl-shaped structure. All your reproductive organs there, your bladder's there. Okay, they protect certain parts of the body. However, the two arteries with femoral arteries, when they come down, the descending aorta would split about the pelvic area and run over the top of that pelvic bone. Okay, lower extremities exist on the thigh and leg. Okay, the thigh bone, the femur, is the longest, strongest bone in the entire body. The lower leg or the lower extremity has two bones called the fibula and fib and tibula, tibia and fibula. Okay, ankles are tarsus and feet metatarsals, toes and phalanges. Kneecap is a small flat bone that protects the knee joint. Ankle and foot, as I say, are a lot of smaller bones as well. Joints, there are many different types of joints we get. Gliding joints, they're held together by tendons and ligaments, lubricated with a thin fluid surrounding, obviously, cartilage, which stops bone ends from rubbing together. Synovial fluid is in a sac surrounding the joints. Okay, and often we get types of inflammation and things like that in that fluid surrounding the joints. There's the joints again, fused joints, hinge joints, ball and socket joints, just allow movement in certain directions, certain areas. Some people that think they're double jointed might have the fact that the ligaments are a bit looser than others, and obviously excessive use of joints will cause these things to become even more loose if they are doing things they shouldn't be doing with those joints. All right, the muscular system. Now let's look at the muscular system. Muscular system is important for a few things. First of all, there's three different types of muscle types. Skeletal muscles, which supply movement and strength and support for the body. Okay, they contract and relax and move our body around. Smooth muscles are automatic actions, okay, or involuntary muscles. They are things like the arteries, the intestines. A swallowing action sometimes is called smooth muscles. Okay, cardiac muscles are only found in the heart. Okay, never anywhere else. Cardiac muscle, when cardiac muscle dies, it is replaced by a scar tissue, which is like a fibrous tissue, not cardiac. That is why it's so important to keep the heart muscle alive. The nervous system governs the body's functioning, consists of the brain and the spinal cord, individual nerves that extend throughout the body, the sympathetic and parasympathetic nervous system. Okay. Obviously, they have sensory and motor neurons. All these things that can touch, sight, and feel, and things like that, hot and cold, will all send signals back to the brain, and the brain again will send things forward. The brain is the body's central computer. It allows for thinking, voluntary and involuntary actions. The spinal cord is a long tube-like structure that extends from the base of the brain all the way down the spine and has pairs of nerves leaving the body. Digestive system, the one we like, breaks down your food, starts in the mouth with a chewing action. Enzymes are added with the salivary glands, saliva in the mouth, and we break down the food from there. Food is not, the food that is not used is eliminated. Okay, the major organs in the digestive system are located in the abdomen. So it starts in the mouth and ends up in the stomach, from the stomach to the small intestine. Small intestine moves into the large intestine colon moves into the rectum, and it is evacuated from the body. All right, like I said, there we go. All the stages: throat, esophagus, stomach, small intestine, large intestine, rectum, and anus. There we go. Now, the digestive system also has 3 other little organs involved in there. The liver, obviously everything we put in our mouth gets purified going through the liver. Blood goes through the liver purifies it. The gallbladder adds things like bile, which helps in the processing and breaking down of fats. And the pancreas would be involved with secretion of insulin and things like that to facilitate the movement of sugar across the cell membranes. Genitourinary system, all the reproductive systems fall into this place, not only involved with the reproduction, but also the removal of waste products. Remember, your kidneys filter all the fluids, the blood, takes out all the waste products. Waste products move with liquid down the ureters, into the bladder, and from the bladder out through the urethra. Major reproductive organs in the male include producing testes, which produce sperm, and penis, which delivers the sperm. And obviously in the female, ovaries produce eggs. Uterus holds the fertilized egg during pregnancy, 9 months, 36 to 40 weeks. The egg released by the ovary travels once a month, travels into the uterus through the fallopian tubes, and if it is fertilized, then it will grow in the uterus, and when we give birth, it will come out the birth canal or the vagina. Okay, kidneys are involved in the removal of waste products, as I said to you just now. They filter blood to form urine. Urine flows down the kidney tubes through the ureters into the bladder. Bladder collects and stores urine before it passes out through the urethra. The skin. The skin is the largest of all these organs. Okay. It also protects our body from harmful substances outside. Our main reason with the skin, though, is the regulation of body temperatures. If you get hot, you start to sweat. You get red. The skin, the arteries dilate in the skin and allow it to be cooled. Okay, that sweating action, when they remove the heat, when the water evaporates, it cools the surface. Okay, and it's also involved with the transformation or transmission of information from the outside to hot and cold, windy, things like that. The skin will tell the brain what's going on outside. It consists of a couple of layers. The dermis is a deeper layer. The epidermis is the outer layer, which forms a protective barrier. Underneath the dermis, there would be subcutaneous tissue or fat, which insulates and helps protect the body inside. There's a good little picture. Hairs, sensory organs, epidermis, dermis, and subcutaneous layers. All right. Skin is a protective barrier for bacteria and viruses, as long as it's not broken. The skin can perceive sense, like I told you just now, touch, pressure, pain, degrees of hot and cold, things like that. Okay. Life development, obviously, as we grow, the body changes. In an infant, the airway is very small and is easily obstructed by swelling or objects. Because toddlers have poor coordination and balance, they have a high risk of falling. With that, babies' heads are always bigger and heavier than the rest of their body, so there's always chances of good bangs on the head. School-age children are obviously more physically active and prone to injuries, bicycle riding, sport injuries, things like that. Adolescents don't fully understand the consequences of dangerous actions, before they kind of like get beaten up regularly. There's no way of surviving a shopping trolley going down a hill, but only an adolescent would do something like that, we hope. Early adulthood is a period where most of the body systems are fully functional, fully developed. We're busy going through the prime of our life at this stage. Early adulthood is generally a time when the body system starts to develop. That spot when you hit like 40. Okay, we're starting to go downhill from that side. And late adulthood, the decline becomes more pronounced. Physical abilities are reduced, mental capacities sometimes reduced, and general abilities are definitely on the decline. Everybody's obviously affected differently at this point in these things. When we look at our body and our vital signs, we're always looking for baseline vitals. When I talk about baseline vitals, I'm talking about pulse, rate, rhythm, quality. I'm looking at respiration, rate, rhythm, and depth. Blood pressure, is it high? Is it low? Pulse rate, we spoke about just now. Normal vital signs change with age, especially your blood pressure and pulse. Okay, so you must always remember these things. As you get older, your pulse rate will slow down. Babies, a pulse rate is much higher than an adult's. It's 120 to 180, whereas an adult would be 60 to 100. Okay, systolic blood pressure increases as we get older, usually your age plus about 20 or 30. There's a good table to take note of with all the vital signs that we need. As you can see there, infants have got a rather low blood pressure, but adults have a rather higher pressure. Anything above 80 for a lady is borderline on high. Anything above 90 for a man would be borderline on high. The systolic and diastolic breathing rates and pulse rates, respirations, all vary. It's important to know these baselines or vital signs so that we know what's happening when we're treating a patient. All right, there we go. There's certain things that can push up these pulses or these vital signs, and there's certain things that can decrease it. Okay, just be aware that most of these vital signs that we're taking are done at rest. Breathing at rest, 12 to 20 breaths per minute. Pulse at rest, 60 to 100 beats per minute. Regular and even, or hard, or bounding, or thready, or weak, whatever you're looking at. We're going to just find words to describe what we're looking at.